Hello, second period anatomy. Today I will be doing a presentation on rickets. What are rickets? Rickets are the softening and weakening of bones in children, normally due to a deficiency of vitamin D. Rickets are caused when there is a vitamin D deficiency, and it makes it more difficult to maintain calcium and phosphorus levels in bones. How many people are affected by rickets? Studies show that 1 in 5 people or children are affected by rickets in the middle class. You generally see this in young children and babies can show signs of rickets in the first 12 months of their life. Some risk factors involved with rickets are dark skin. Dark skin doesn't react to sunlight the way a lighter skinned person would, so it produces less vitamin D if you have darker skin. A mother's vitamin D deficiency during pregnancy also will affect a child's chances of rickets. A baby born to a mother with severe vitamin D deficiency can be born with many symptoms and signs of rickets and will probably develop them in the first few months of their life. Another risk factor is medication. Certain anti-seizure medicines or medicines used to prevent or treat HIV infections will interfere with the body's ability to use vitamin D. And then there's exclusive breastfeeding. So if a mother is breastfeeding for a long period of time, they need to use vitamin D drops. This is because breast milk does not contain enough vitamin D to prevent rickets. Children who do not get enough vitamin D from sunlight and food develop a deficiency. With sunlight, your body produces vitamin D when it is exposed to sunlight. Children in developed countries tend to be more likely to get rickets because they spend more time indoors, so they're getting less sunlight, and they also use sunscreen, which blocks the rays that trigger the skin to produce vitamin D. There are also foods that if you are not eating, you're more likely to get rickets. Those foods are like foods full of calcium, like milk, but there's also foods like cereal, and you can also have like fruit juice and fish and eggs, and those will also help with levels of vitamin D. Some children are born or they develop diseases that affect the way their body absorbs vitamin D, so they could also develop rickets due to that. And some of these diseases that affect one's ability to absorb vitamin D is celiac disease, inflammatory bowel disease, cystic fibrosis, and kidney problems. Treatment may involve adding vitamin D or calcium to the diet. You can also use medications, and in serious cases, you could have to have surgery. Some dietary supplements that could be prescribed are calcium acetate, chlorocalciferol, ergocalciferol, paracalcitol, and calcitriol. For some cases of bow legs or spinal deformities, your child or one's child may get assigned like a brace or something that will push their bones into a normal position and help it grow appropriately. Unfortunately, there are some deformities like that of the pelvis or the chest that are permanent, and there's no way that can be reversed. Here's a picture of the disease, and here's a normal picture. Some of the effects on the body that are general effects are bone tenderness and pain, dental deformities, delayed formation of the teeth, decreased muscle strength, impaired growth, short stature, skeletal deformities like bow legs, ribcage abnormalities, and seizures in severe cases. Because the body isn't getting vitamin D, it also is not getting calcium and phosphorus. This is the specific reason why all the general effects are happening to your body is because of the lack of vitamin D. And that is all. Thanks.